In this short film, I'll be demonstrating some of the basics of acupuncture treatments and hopefully in the process showing that it doesn't need to be as scary as it might seem. On a first visit, I take a detailed case history so I can get a good idea of where any imbalances might be occurring in your body. Acupuncture is a holistic medicine, meaning that it treats the whole person, so there'll be questions about health aspects that don't seem obviously connected to your main problem. I take the pulse on both wrists, but I'm feeling for more than just the rate of the pulse. The force and quality of the flow carry a lot of useful information. The tongue also gives an indication of what's going on inside the body. More diagnostic information can be revealed by carefully feeling parts of the body for temperature, tenderness, etc. Before handling needles, I carefully wash my hands. The needles are packaged in sterile wrappers and I only ever use them once. They're extremely fine, much thinner than a hypodermic needle. There are hundreds of acupuncture points in very specific places. Even if your health issue is purely physical, the points I use won't necessarily be at the site of the problem. Once a point has been located, the needle is usually inserted via a small plastic tube as demonstrated here. The needle is then gently manipulated, which often causes a dull, achy sensation which most people find quite tolerable. Sometimes other methods are used to stimulate the points, depending on the problem. Electroacupuncture involves passing a mild current between two or more needles. This usually feels like a ticking or buzzing sensation and is always kept within the patient's tolerance levels. The points can also be warmed up using a technique called moxibustion. Here I'm using a moxa stick made of compressed herbs and charcoal. The stick is heated with a flame and then held near the skin either with or without a needle inserted. Another way of doing this is to use small moxa caps which sit on the handle of the needle. A cardboard guard is used in case any ash falls off. The needles are usually left in place for about 20 minutes, after which they are removed and carefully disposed of. For people who really don't like the idea of needles, I sometimes use an electrical stimulation pen. Similar to electroacupuncture, this passes a mild current through the points. Another technique is cupping, which involves placing suction cups on the skin to stimulate blood flow. Although this isn't painful, it can leave red or purple marks for a few days following treatment. Thanks for watching. I hope you feel you know a little bit more about acupuncture now. Have a look at my website www.tomtheacupuncturist.co.uk for more information, and feel free to email me tom@tomtheacupuncturist.co.uk if you have any queries.